Hi everyone, thank you so much for joining me today. I'm Dr. Tahir and I'm a board certified pediatrician. Today I'm going to talk to you guys about why your baby or infant may be tugging and pulling at their ears. You know, this is a very, very important topic because I see a lot of parents and kids every single day at the office concerned about just exactly that. You might be worried that your baby has an ear infection, and rightfully so, because sometimes it's very, very hard to tell. And so today I decided to talk about this topic because I think you'll find this very, very helpful. Now, if you enjoy learning about common and important health topics about your children, please take a moment and hit the subscribe button right now if you have not done so already. And remember to share this channel with your friends and family, and also take time now or while you're watching the video to put in some comments and feedback and suggestions. Share your experience, and your thoughts and experiences can be very helpful for everyone that's watching this video. Okay, so let's talk. Reason number one is teething. Teething happens when your baby's teeth are erupting through the gums. You'll notice that there might be swelling in the gums. You might see the tips of the tooth erupting through the gum itself, and you'll notice your child putting their hands in their mouth a lot. They might be super fussy, drooling a lot, maybe not eating as well. They might have a temperature that's lower than 101 degrees, okay? So 101 degrees is kind of an important number to remember because teething doesn't really give you high temperatures like infections do, for example. You see, really young kids have a hard time telling where their pain is coming from, so teething pain can feel like ear pain to them and vice versa. There are also nerves that cross-innervate the two areas, so pain in one area can feel like pain in another area. Usually teething starts at about 4 months of age and goes on to about 2 years of age. And there's a lot of variation though. Usually you'll see the bottom two teeth come out first, but that's not always the case. So my younger daughter, for example, did not have teething till about 9 months of age, and I was really worried about it. And I'm a pediatrician, but I knew that was normal, but still I was worried. So if your kids are not teething right away at 4 months of age, it's okay. So anyway, when my daughter first got her teeth, she got her canine teeth, and it was the cutest thing, and we have a bunch of vampire pictures of her. So your child may also get their canine teeth coming in first, but usually it's the bottom two teeth. But just remember, there is a lot of variation, okay? When kids are teething, they can be picking at the ears, like I said, and so it's hard to tell if that's an ear infection or not. The way you tell is the degree of fussiness. Usually with an ear infection, kids are much, much fussier than they are with teething. And also you'll be seeing signs of teething. For example, bumps on the gum, salivating, putting their hands in their mouths. If they're doing that, and also their temperature is less than 101, you can be pretty comfortable knowing that this is probably teething. You can try giving your child some pain medication such as acetaminophen or ibuprofen, for example, and also some cold things to gnaw on. If that helps, then just rest assured it's teething and they'll be just fine. Reason number two is nose congestion. Babies have very small nasal passages, so anything can get them congested. Just a little bit of mucus in their nose can cause congestion. Changes in temperature, maybe even spitting up or vomiting can cause some nose congestion. Colds, of course, are very common reasons for nose congestion too. So when the nose gets congested, the ear can get congested also. The reason is that there is a tube called the eustachian tube that connects the ear to the back of the nose area. That tube helps to equalize the pressure in the ear, and when the nose is congested, that can also get blocked a little bit, and your babies can build up some pressure in the ear. They may feel like they're sitting on an airplane, for example, and so they'll be picking at their ear when they have nose congestion. That can seem like an ear infection, but with an ear infection, usually higher fever than 101, a lot more fussier. And if you're noticing your child's nose is congested, you might want to try suctioning the nose or using some saline nose drops, putting some nose drops in the nose and just leaving them there, or putting nose drops in the nose and waiting about maybe 30 seconds and then suctioning. That'll help decrease some of the congestion they have in their nose, and you may also notice that they're picking on their ears less. You can also use some pain control medication like Tylenol or ibuprofen, for example. And if that helps them, they're feeling comfortable, you can wait and see what happens. If you feel that they're getting better and better, just know that they may be feeling some ear pain because of the pressure in their ears due to nose congestion, and that they don't have an ear infection going on. Reason number 3 is exploring the body. Every single day, babies learn something new. You'll see them making a new sound, looking around, noticing you. And at some point, they discover their hands and their ears and their nose and their bodies. So they're exploring their bodies. You'll notice them picking at their ears as part of exploring their bodies. And you know that's not an ear infection because they won't be very fussy. They'll be happy, they'll be all right, but they'll just be pulling and tugging on their ears for really no good reason. When you feel they're pulling at their ears for no good reason, and they're not very fussy, not having fevers, eating well, rest assured it's not an ear infection, and they just might be finding a new part of their bodies. Just part of growing up as a baby and finding out about your body and finding out about the world. Reason number 4 is anger and frustration. All parents know that babies can get angry and toddlers get angry all the time too. Some babies and infants pick at their ears when they're angry. Sometimes they pull at their hair behind their ear. So a lot of the anger behavior for babies and infants, I've noticed, is pulling behind their ear. Not necessarily on the ear, but it can look like it's on the ear, but you'll notice them reaching behind or sometimes even going like that and pulling their ears forward when they're angry. The way you know that's not an ear infection is correlating their pulling of their ears with their anger. And also they won't be having fevers, for example, and they'll feel better when they're not angry anymore. So if your child is pulling and tugging on their ears or behind their ears when they don't get their favorite toy, that's a sign that it's a behavior and it's not an ear infection. Reason number 5 is feeling tired and sleepy. This is also a very common behavior that kids have at a young age. Usually I'll notice this at about maybe 7 months of age to about 12 months of age. At that time you'll notice kids pulling and tugging on their ears or putting their hands behind their ears when they're feeling sleepy. Sometimes they'll do that just before they fall asleep, but usually you'll notice that when they're just tired. And you'll see them pulling both of their ears or putting their hands behind their ears. A lot of parents worry that that might be an ear infection. However, you can tell it's not an ear infection when it correlates with your child being sleepy. Also, they won't be having fevers, they won't be super fussy, and when they fall asleep, they'll be perfectly fine. So if you're noticing that, just know that things are all good and your child is just sleepy. And usually kids grow out of this by about 1 year of age. Reason number 6 is eczema and sensitive skin. There are a lot of babies that unfortunately suffer from eczema and sensitive skin. They'll have very itchy cheeks, foreheads, ears, body. And if your child has eczema and sensitive skin and they have breakouts of the skin, they might be picking at their ears and pulling at their ears because they have irritation in the back of their ears. Back of the ear irritation is one of the most common places for eczema to affect babies and young kids. You'll notice redness right in the crease where the ear meets the back of the head. Some drainage maybe, moisture there, and a lot of irritation. And it can be very, very painful and also very itchy. And so if you notice that your child has skin breakouts, red discoloration behind the ear, and they're picking at their ears, most likely it's from eczema or sensitive skin. The topic about eczema and sensitive skin is huge, and I'll make a separate video about that. But in short, if your child has irritation in the back of the ears, just dry the skin really well and apply some over-the-counter 1% hydrocortisone cream. That cream is often called like an anti-itch cream, and it's available without a prescription. Use it about twice a day, and probably in about 2 or 3 days, you'll notice an improvement with that. Usually if your child has irritation there, there's irritation other places too, but for right now, I'll just address the irritation in the back. Also make sure you use unscented soaps and detergents because fragrances can also cause a lot of problems for babies who have sensitive skin. Now, if you find that there's irritation and you treat it and your child is feeling better, you're good. They don't have an ear infection. Reason number 7 is ear infections, and this is what most parents are worried about when their kids are pulling at their ears. So with an ear infection, babies are usually very, very irritable. They are picking at their ears often, and they may have fevers higher than 101 degrees. They may not be eating very well, may not sleep very well, and usually ear infections follow colds. So if your child has had cough, congestion, or runny nose, for example, and then you find them pulling and tugging on their ears, and they're very irritable and have fevers, that may be a good sign that your child may have an ear infection, and you'll definitely want to get your child checked out. Always remember that you and your healthcare provider know your child the best. Remember to always see your healthcare provider if you have any concerns or questions, or just not sure about what's going on. I want to thank you again so much for joining me today. Please take a moment now to give some feedback, write some questions, share your personal experience in the comments below. Thank you so much, and until next time, I wish you peace, wellness, and health. Bye-bye.